Okay, great. Hi, I'm Vanessa Alvarez. I am a VP of mentorship with Mi Mentor in the SoCal region. And I hope to get everyone a little bit more familiarized with what our mission is. So, we are a nonprofit organization that really is trying to diversify and be a very inclusive organization to provide mentorship for the next generation of healthcare leaders in underserved communities. And that's really the mission statement behind a lot of our events, such as this one. So we carry on multiple events throughout the entire year. It's completely free of charge to join. And right now we're coming in at around 11,000 members. So we'd love if anyone who's not joined could join us, because we do provide multiple resources. So it's not just events and webinars such as this Together We Mentor or Together We Lead events that are a little bit longer and they're more kind of like seminars. But we also provide multiple resources for scholarships and employment opportunities, just things that will help bolster your pre-health journey to professional school. Because it is pretty difficult when you don't have mentorship and when you don't have that road paved for you, especially if you're first generation or you come from underserved communities. So we're very open to welcoming any sort of new member. And just as you're joining this Together We Mentor event in collaboration with AltaMed, we also do multiple collaborations with and that will help you at any stage in your pre-health journey. So whether you're applying to professional school and you need help with fine-tuning your interview skills, or if you're looking to get a mentor or looking into a post-bac program, we have multiple webinars that are accessible to anybody and everybody, and they're free of charge. So please take a look at our organization if you'd like. We're here and available to answer any questions you guys might have regarding the organization. Personally, for me, I'll just share a little bit of my experience. I've been with Mi Mentor for 3 years and I'm finally on the general board. And I think I'd been so lost if I didn't really know the direction in which I wanted to take my pre-health journey. And Mi Mentor really helped me kind of find that direction and kind of fine tune exactly what my niche is and have not just guidance, but also a lot of support, which is extremely and just as important as guidance. So it's, again, a community of over 11,000 members where dispersed throughout different stages in their career, whether they're pre-health, whether they're medical school or professional school, whether they're already physicians practicing medical practitioners. There's just a huge diverse community of different types of people who are there to really support each other. So thank you guys for your time. I'm really excited to get this webinar started. We've been collaborating with AltaMed for a few months now, and we're really excited to provide this application clinic to really just break down and facilitate that application process for this amazing program. So I'll just kind of wrap it up now and hand it over to the AltaMed team. Thank you, guys.
Thank you, Vanessa. Hi, everyone. Again, my name is Eric Leva. I'm with the AltaMed medical education team. I'll be one of your facilitators for today's presentation. Just quick announcements. We are recording today's presentation just to make sure that it's accessible to folks afterwards. And also, if it's okay with you all, please have your camera on just to make sure that it's a little bit more personal. And we'll be also monitoring the chat box. So in case you have any questions, we'll definitely be able to answer them throughout the presentation and as well as after the presentation for today. I will go ahead and share my screen, but before I do want to acknowledge Dr. Marco Angulo, who's our medical director for medical education, and allow him to see if he can share a few words with us. Thank you, Dr. Angulo.
No, thank you so much, Eric, and Vanessa, thank you for your awesome words. I am honestly always awed by the people that come out of Mi Mentor. It's just been a phenomenal resource for everybody, a phenomenal family. And just seeing everybody work together and people that are now in medical school that have been part of this and still contributing back to it, it says a lot about the organization. So congratulations with that. First and foremost, I just wanted to say how proud I am that you're here, that, we're going through the worst pandemic we've ever had. The surge is here. We've got no vaccines, and yet you're still probably even more encouraged to go into the health field. You're probably more encouraged to say, you know what, I can make a difference, and just thinking back for myself, pre-med was probably, or pre-health was probably the toughest time for me because, there was other factors than just biology. There was other factors than just chemistry. It was, you know, how much time is it going to take? You know, it was like the families thinking, you know, what are you doing with your time? Is this all worth it to me? You know, are you spinning your wheels? All these things come in mind. Maybe getting an exam back and you're like, I don't think I'm ever going to get in, right? Those things always came to my mind. And now looking back, I think, oh my goodness. And not only that, now meeting with 20 years worth of students and maybe over 1,000 physicians that are now practicing, meeting with those students and just kind of looking at you and saying, you know what, I hate to burst your bubble, but if this is what you want to do, if this is where you want to go, you're going to get in. You are. I can guarantee you that. I can actually put my MD on there and say, you're going to get in and you're going to do it. Now, with that being said, the special thing about Mi Mentor is that you have that ability to want to serve the underserved community. And believe me, right now, you see the news, Latinos, African Americans, the highest in COVID, Latinos and African Americans, the lowest getting vaccinated. And if that doesn't frustrate you, and if you can't say, you know what, I need to make a difference, I need to be there, then I'm more than positive I'm talking to the right group. You know, and for me right now in AltaMed, because I'm also, I work with as a medical director here, but we're also part of the vaccine rollout. And our job is to make sure that our population is vaccinated. Our underserved population is first, as opposed to anybody else. But that makes me proud because that's why I went to medical school for, to make sure that my community had a voice. And when I meet with you guys, I feel that as well. So that's what makes me so proud to be here and proud to be with you. With that being said, we want you not only just today, we want you to apply and continue that process so where you can practice your medicine, practice your public health wherever you want. And with that being said, we have a program in the summer. It's called Health Career Opportunity Program that we want to coach you through that process. And we want to make sure not only that you have clinical skills, that you have medical school mentoring for medical students, and that you feel like if you're in your first, second, third, fourth year of medical school. It's like a sneak peek behind the scenes, getting you ready, getting you ready for that next step. We want to make sure you do that. Not only that, in the program, we actually have personal coaches that create a portfolio just for you through the process. And Eric will talk a little bit about that. But our job with you in the program is to get you to the next step. And I think Rosa's here, right? Rosa Magaña's here somewhere. So she'll talk a little bit about her trajectory. But you are that future, you are that next generation, and we have to invest in you. We want to make sure that you have all the mentorship that you need. You're already getting it from Mi Mentor. We want to add that extra personal continued follow-up. But I just want to say thank you for being here, and how proud I am of you and how proud we are of you. And I'm hoping that we continue to work together. And this is what was so special about you guys turning on your cameras, which the ones that you could, because I get to see your faces. We get to learn who you are, and we get to learn more about you. And the more we see you, the better it is for all of us. So that's all I wanted to say, Eric. I'm sorry I took so much time, but keep doing the work. I'm gonna guarantee it. I'm gonna throw it on there. If this is what you want to do, you're gonna get in. Let us help with that little bit of coaching as well with that.
Thank you, Dr. Angulo.
Eric,
Thank you so much. Thank you for your time. I always get super, riled up and inspired by you, and I hear this constantly. So it's always an honor. I do want to make sure that I acknowledge the Mi Mentor team who helped put this event together today. So if it's okay with you all from the Mi Mentor team, before we do get started with our presentation, to just share your name and maybe title with Mi Mentor, if that's okay. And then
I can. Oh,
anybody can go first. Go ahead, Joanna.
Oh, okay.
Thank you.
Good evening, everybody. My name is Joanna Gonzalez, and I am the VP of Mentorship for SoCal Board. And I've been with Mi Mentor for about a year. So I'm really excited to partner with AltaMed and just to provide opportunity for everybody here. And I'll pass it over to Taylor.
Hi, everybody. I'm the VP of Outreach for the Norcal region. This is my first year on the general board, but I've been a part of Mi Mentor probably since 2017 or 2018. It's been really great for me. And so I'm happy that you guys are getting the opportunity to listen to everybody here.
And Vanessa, I think you're the last person already, right?
And
So thank
again,
you.
yeah, I'm Vanessa Alvarez. I am a SoCal VP of Mentorship as well as Joanna. And yeah, I've been with Mi Mentor since 2018, but this is my first year as VP of Mentorship. So welcome everybody. If you guys have any questions about Mi Mentor, feel free to reach out to myself, Joanna, or Taylor. We're more than happy to answer any questions you guys might have about the organization.
Perfect. Thank you so much, Vanessa, and the rest of the Mi Mentor team. So I'm going to go ahead and share my screen. You let me know with a thumbs up if you can see my screen. And then we'll jump into quick introductions from our team, the AltaMed team, who will be facilitating today's presentation, if that's okay with you all. Whoops, sorry about that. So again, as Dr. Angulo mentioned, we are here to present about the AltaMed CDU Health Careers Opportunity Program. And we'll go into more detail of why it's the AltaMed CDU, which stands for Charles R. Drew University Health Careers Opportunity Program during our presentation. I do want to make sure we introduce the rest of our team, along with Dr. Marco Angulo, who's our Medical Director for Medical Education. We do have Annabelle Arroyo and Vanessa Peña Garcia here as well. Annabelle, Vanessa, is it okay if you share a few words before we jump into it?
Sure. I guess I could go first. Hi, everyone. We're so excited to have you guys all here. Like Eric mentioned, my name is Annabelle Arroyo, and I'm supporting our AltaMed team as an undergraduate medical education specialist. So supporting all of our summer programs and pipeline programs. So if you have any questions at all, feel free. And I also provide some of the academic advising for our scholars, right? So once you get into a program to become an HCOP scholar, we track you until you get into medical school. So I remember working very closely with Rosa. I know she's here. I'm like trying to find her in the squares. Oh, there she is. With Rosa, when she was applying, because when she applied to HCOP, she was also applying to med school. So sitting down with her and going over secondaries and everything else that is required, right? I've been doing this for a long time. I was a pre-health advisor at UC Berkeley along with Marco. I really love working with students like yourself. So if you have any questions, feel free to ask as well. Thank you. Vanessa?
Thank you, Annabelle. Hi, everyone. My name is Vanessa Peña Garcia. I'm a coordinator here within the Medical Education Department under the AltaMed Institute for Health Equity. Any questions you have, like Annabelle and Eric were saying, please feel free to put them in the chat and we'll go ahead and answer them. I'm also heavily involved with Mi Mentor as well, and I'm readily available on there, so you can go ahead and message me and I'll reply. So we're super excited to have you all here. Yeah.
Thank you, Vanessa. I will also want to make sure that we introduce Rosa Magaña, who is, as Annabelle and Dr. Angulo mentioned, here with us today too, as a program alumni and currently an MS1 at UC Davis Medical School. And then, Rosa, do you mind introducing yourself, please?
Sure. Hello, everyone. Good to see all of your faces. Lots of handsome, gorgeous people here today. I was part of Mi Mentor as a mentee. So I was in the MSR readiness program. And then I decided to apply as an ambassador. That was great. Just because Mi Mentor, you know, they give so much. So I wanted to find a way to give back after ambassador. I'm now CMO, which is Chief Mentoring Officer, as a med student here at UC Davis. Let's see, there's, I don't know if I should talk about my path now or later, like with a slider, Eric.
Whatever you think's best, Rosa.
Okay, and you know, I'm a career changer, so my path is a really long one to get here. And like Dr. Angulo said, the struggle is real, but you can get here, you know. You can get to med school, and then one day I'll be a doctor like Dr. Angulo. And so it's just like a ladder, and you got to help others as you're climbing up, right? And that's why we're here to do this.
Thank you so much, Rosa. And I know, I also see, I was looking at who's here with us today, and we also have Priscilla Molina, who's another alumni of our program and also a team member with the medical education team. Hi, Priscilla, do you want to just quickly say hi, if that's okay with you?
Yeah, hi everyone. My name is Priscilla. I'm also an HCOP alumni. I actually just participated this past summer, so I was the guinea pigs on the online version of this program. It was so amazing. I really had a positive experience. So maybe at the end, if there's any questions, I can share more so of that experience through that online platform. And then right now I'm currently working for AltaMed, which is pretty cool. I stayed connected after the HCOP program, and I'm a health navigator. Which I can share more about as well. But yeah, I'm happy to be here and just support and answer any questions if there is any.
Thank you so much, Priscilla. So without further ado, we'll jump into our presentation. I know a lot of us are saying AltaMed, and you might have questions of, like, what is AltaMed? Like, who is AltaMed? And just to share a little bit of background of, our history of AltaMed is we were founded in 1969 as a East LA Barrio Free Clinic. When we started this, maybe actually, Dr. Angulo, if you don't mind entertaining us with really quickly with, of how AltaMed started with the donations.
Eric, you were doing such a great job. I'll go with the donations. Yeah, it was just down the street from where I'm at right now. I'm at AltaMed University in Commerce, and the first clinic was on Whittier Boulevard, and it was just a lot of medical students and physicians that wanted to give back to the community, and they created a free clinic. And they would do child checks for the kids. They would do family medicine, pap smears. And they only asked the patients if they felt it was good service or however that they could donate whatever. So people would have like a little water bottle thing, and they would just put money in there, and they would that's how they would survive. And then throughout the years, AltaMed started getting a little bit bigger, and we started getting a little more resources, a little more grant funding. And I believe I don't know if Eric, if you have it on there, but in 1978. And beyond, it became a federally qualified health center. And federally qualified health center just means that we are a safety net for the community. So in other words, if a person comes to us and says, oh, you know what, I don't have any insurance, I don't care. I could see you as a patient. If they say I can't pay, magically as a doctor, I could waive the cost. And it's okay, so we want to make sure to cover everybody. If I'm undocumented, that's fine, come and see me. So it's for us, it's to make sure that we're covering every single person in the United States. So proud to work for a federally qualified health center, and I would never work for anywhere else. It has to be an FQHC. Sorry, Eric, you keep going.
No worries. Thank you so much for that. I always just enjoy you listening to you. So along with being an FQHC, and the mission of an FQHC is really to serve the medically underserved, those folks that otherwise would not have access to healthcare, don't have health insurance, might not have health insurance. We want to make sure that we're in our communities, and we wanted to share a little bit about who our patients are, right? So I know these numbers might be a little different now. But we've had over a million visits a year with over 300,000 patients, and over 80% of our patients are either Latino or Latina, and who are Spanish speaking. We have over 43 sites throughout LA County as well as Orange County. If you've lived in any of these counties, I'm sure you've driven down either the freeway, the street. If you've maybe seen the billboards, seen the clinics throughout the communities. And I take pride in that, and I'm sure the team does too, right? Making sure that we're visually representing our communities wherever we are. And as you can see, our providers are also very much part of the community as well. This image here, I think, was taken this past summer when there was a lot of actions regarding, Black Lives Matter and a lot of the actions for George Floyd. So we always want to make sure that we're constantly, with our communities and fighting for social injustices as well. And now we'll jump into program description. Before I do, Vanessa and Annabelle, anything else you would like to share about AltaMed?
No, I think you covered it, Eric. You did a really good job.
Thank you. Vanessa's always one of my, big fan. Thank you, Vanessa. We'll jump into a program description. And as Dr. Angulo mentioned, right, why is it that we have a summer program at AltaMed, and why is it that we're so invested in making sure that you're all, finding out about this program and making sure that these opportunities are available to you all, is that, as Dr. Angulo mentioned, right, there's a need of providers that look like us, that are from our communities, making sure that we're serving our communities because we know our communities best, right? In this program that we're here to talk about today, HCOP, or Health Careers Opportunity Program, is a partnership with Charles R. Drew University. We received a grant from the federal government to have this partnership with CDU in having a summer program. So CDU has different components of the program during the school year, but for this summer program that we're talking about today, AltaMed has really that takes the lead in planning the curriculum, and as well as doing recruitment for the summer. As you can see here, the program is non-residential. I think Priscilla mentioned it, that this past summer was all virtual, and then the summer of 2019 with Rosa's cohort, it was in person, obviously, because that was before COVID. This next year, it's this upcoming summer, it's looking like that it might be a hybrid program, and we'll have more information as we get closer to the summer as well. By participating in the summer program, you will be eligible for a stipend of up to $2,500, because we want to make sure that you're also being compensated for your time with us. And I'll go into more program components. The team will also be able to provide more context, about the different components for the summer. So during the 6-week summer program that you're with us, we do have 4 main components of the summer program that we build the rest of our curriculum or our schedule based on, which the biggest being we have a tiered mentorship approach, which means that we have, during the same summer program that you will all participate in, we also have another summer program with medical students that spend the same time of the 6 weeks with us. And you'll be able to interact and also network and get to know these medical students throughout the summer that you spend with us. And as well as we'll have providers who have dedicated their professional lives, as well as like the Dr. Angulos of the world, who are highly invested in making sure that our next generation of providers are also mentored throughout their journey to getting into that health professional program that they want to get into. And our curriculum is also based on a health equity component, meaning that all of our workshops, all of our presenters are highly invested in health equity and making sure that we're fighting against social determinants of health, that we're also providing workshops on what it means to be a first generation provider, because as Dr. Angulo can mention as well, a lot of these, what would it be like barriers or experiences that we have as first generation students don't stop, once you become a doctor or a health professional. They may just, present themselves in a different manner, but they continue, right? So we have different speakers throughout the summer, providers as well, who speak on physician wellness and making sure that, we're sharing knowledge with the next generation as well. Team, anything else I might have missed from those 2 components, the tiered mentorship or the health equity component?
No, Eric, you got everything. Marco, did you want to say something?
Tiered mentorship, health equity. You talk about the virtual clinic precepting, right?
Yeah, we were about to jump into that right now. Thank you for that.
Yeah.
Feel free to also chime in for this portion. But for the clinical components, and the reason it's virtual was because this past year was all virtual. But for the clinical experience component of the summer program, we host different clinical workshops, but also different presentations on making sure that you're able to interact with virtual patients through a service called Kaplan's iHuman. And throughout this, subscription that AltaMed will purchase, you get to interact with virtual patients, and you get to be led through clinical cases with a provider such as Dr. Angulo or some of our other providers who walk you through. You're able to ask the virtual patients questions about how they're feeling today. And at the end of the case, you're able to have a prognosis based on all the questions that you ask the patients. Anything else I might have left off from that virtual component?
I think the only thing I would
That's it.
add, Eric, go ahead, Dr. Angulo.
No, go ahead, Annabelle.
I think the only thing I would add is like the reason that we want to expose you, right? The reason why we did it virtually this year is because that's the capacity that we had with the pandemic. And at the same time, we want to give you that exposure to a clinical setting before you get there, right? We know a good majority of our scholars who apply to the program are pre-health, pre-med, public health, behavioral health. So we want to give you that interaction of what it is to be part of a clinical team and ask those crucial questions that most students don't learn until they get to medical school, right? Unless you've been a scribe, you've been exposed to that, what a SOAP note is, how to do a history, how to do a physical. So we want to give you that early exposure now before you get there, right? Because we know that the dinner conversations in your home, and it wasn't like this at our home, we weren't talking about how was your procedures or how many patients did you see, right? It was more about like, put on the telenovela and stop talking because this is what's happening right now, right? And that's a disadvantage that a lot of first generation students have, right? That in comparison to a lot of their cohort or a lot of their classmates, that's not what the dinner conversation is, right? It's about, you know, have you looked at the latest evidence-based research articles? Have you looked at this, right? Because their parents have been college educated. So we want to make sure to give you that exposure. So when you do get there, you are fully prepared. And I know, Dr. Angulo, you wanted to mention something.
Well, no, you said it wonderfully. I want you to start thinking like a doctor. A lot of us as physicians will be there with you. The medical students will as well. But this virtual clinical preceptorship is where you start, you actually get a patient. And the patient comes in and you have to say, how can I help you today? I'm coughing, and work through that case all the way through from taking a whole history, doing a physical exam, ordering the labs. Do you order a chest x-ray or not? Reading that chest x-ray. And at the end, what is your differential diagnosis and how are you going to treat that patient? We will walk you through that whole aspect. And it's I love, that's my funnest part because it's the clinical aspect of it. But it's pretty exciting to see the undergraduates I just get blown away by how you're already thinking in that aspect, So it's something that we wanted to make sure that you have that experience.
Thank you, Dr.
Eric,
Angulo
I'm sorry.
Yes.
I have a meeting at 6:30, but I wanted to say I'll leave you guys. But thank you for everything. Thank you for coming and being a part of this. Appreciate it.
Thank you, Dr. Angulo. Have a great meeting. And we'll continue with our next component, and we'll share a little bit more information on the scholarly activity component. During this component for the 6-week summer program, you get to participate you're placed in groups with medical students as well as other pre-health, pre-med folks in the summer, and you're able to work on community-based research projects throughout the 6 weeks of the summer program. Vanessa Peña, who is our pretty much helped put together this component, will share a little bit more information on what you would be doing during the summer.
Yeah, thank you, Eric. So in short, basically the scholarly activity is developed by what we call our subject matter experts, and they're housed within our AltaMed Institute for Health Equity. So all of the research projects that the summer scholars get to work on are based off of that, and basically the whole program, right, is based off of health equity and tackling health equity. So some of the projects included like provider and patient language concordance. That's just a fancy way of saying of having your provider speak the same language as you as a patient. Sorry, was there oh, I think someone's muted. So that was one of the projects. Another one was evaluating our Health Navigator program that we have within the organization. We had a housing homelessness project as well. Sorry, I think. Let's see what else. So scholars get together every week and meet with their subject matter experts, and they get to incorporate a variety of research methods like systematic literature reviews and how to do that, right? How to even go about looking for, research articles, which ones to use. And then like Annabelle was mentioning with the virtual clinical component, we really want to prepare our scholars for grad school and whatever route they choose, right? Because oftentimes, doctors get to their clinics and they're asked to develop a research project based off of, their patients' diabetic levels, or, that's just one example, but oftentimes they're asked to do this and they don't have any experience, right? Because they just didn't have the opportunity to conduct research. So that was our goal in forming the scholarly activity component. Specifically, doctors are often looked to develop quality improvement projects. Those are basically just taking a specific process and improving it. And it can be something as simple as like getting our staff to wash their hands, after every patient scene, something like that. So it's just it's just a process improvement. So that's a little bit about the scholarly activity component.
Thank you, Vanessa. Again, to reiterate everything the team mentioned, we just want to make sure that during the summer program and beyond, we're equipping you with the tools necessary, to conduct some of this work that will be very much present and as a health professional once you're out in the field. Moving forward now, after the components, I do want to provide a weekly example of what the summer program will look like. Keeping in mind, please, that this example is based on a virtual week that was taken from this past summer. So this next year might be a little different based on updated policies from the state, county, as well as federal policies regarding COVID-19. But as you can see, the program will be Monday through Friday. That'll still stay the same. And it will be from about 9 a.m. to about 3:30 p.m. or about 6 hours each day. If you can please, sorry about that. If you're unmuted. Give me 1 second, folks.
Sorry, Eric. I'm trying to locate it as well while you're.
No worries. I see it. Okay,
oh, I see it. I got it.
Got it. Thank you so much for that. Sorry, folks, for that. Again, with one of the main messages I want to get across to you all is that our program, even though it is very time impactful when it comes to your activities during the summer, we want to make sure that you're able to participate in the summer program fully, and you're able to give yourself that opportunity to succeed during the summer, because it can be very intense. Not to say that we don't have fun, because I do think we have a blast during the summer. But as I want to highlight some of the different components that we just discussed that we will cover during the summer. As you can see, we build in time for our health equity workshops that we'll have during the summer. This one just happened to be about vulnerable populations, hosted by Dr. Belemick from UCI School of Medicine. We built in time for the scholarly activity that Vanessa described earlier today, just to make sure that you're able to meet with your groups that you'll be placed in, as well as work on your actual research projects during the actual times of the program. And we also have, we built in time for the clinical component that Dr. Angulo also described earlier, because we want to make sure that there's a balance with all these different components during the summer. And we also had medical student panels. These panels might look different this year, of course, right? Because it might be a hybrid program. And we also have different panels on not just medical students, but different health professionals as well, in case you are not pre-med. It's something I believe that, and we also have culture of medicine workshops, like I mentioned earlier as well. This is where we have different workshops on what it means to be a first generation provider, and also physician wellness, just to make sure that you have additional context and insight into what it means to be a health professional once you're out in the field as well. And something I deeply appreciate from our summer program, as Annabelle described earlier, is that we do have academic one-on-ones with all of our scholars. So everybody who participates in the summer program does sit down with Annabelle and create a game plan, really, a plan for whatever steps, whatever next step you need to take to make sure that you stay on the road to that, that health professional program that you want to get into. Annabelle, do you want to share a little bit more insight about those one-on-ones?
Sure, definitely. So once you get into the program, like Eric mentioned, we set up a meeting, and this is completely optional, right? We want to make sure to continue professionally develop you. So not only bring you these individuals that are going to kind of provide that motivation that sometimes we need in this path, but also kind of help you create a plan for your next steps, right? So if your next step is working on your med school application and or kind of creating your own DIY post-bac, right? So we help you and guide you through the process of doing that. And like I mentioned before, I've been doing that for a long time. I used to do it at UC Berkeley, and we created a model. Dr. Angulo and I created a model on how to do this and created a program behind it. So we love doing this work, and so you'll get that one-on-one, those one-on-one meetings.
Thank you, Annabelle. Sorry, I was trying to talk and I was muted.
Eric, I forgot to mention one thing. Sorry. For the scholarly activity component, at the end of the program, you actually get to present your research to our medical leadership. So that's an exciting way to get your name out there, and you get to put it on your CV, your resume. So along with providing you with tools to succeed in your career, we also want to develop you professionally. So we help in all aspects of career development.
Thank you, Vanessa and Annabelle. Yeah, thank you for all that additional context. Along with everything we just covered as well. I take pride in this, and I'm sure the team does as well, because one of the things that sets our program apart is that we understand that life is not a summer program. I think Dr. Angulo or Annabelle or Vanessa said it that one time, and that stuck with me, right? Because I've been in programs, and this is just my own personal experience, that you're in the summer program and you feel like you can do it all, right? Like you get super pumped up, and as soon as the program ends, there's not really no follow-up, and we take pride in making sure that any opportunity after the summer program, any type of opportunity that we can make sure that you stay involved in, we make sure that we offer it to our alumni first to make sure that we continue staying engaged with you all. And then I wanted to also highlight a few of the activities before Rosa's able to share a little bit about her experience in the summer program, as well as Priscilla. This is obviously in 2019 because it was all in person. Now seeing these pictures actually kind of freaked me out, because I'm like, where's everybody's mask? So it's a little bit different now, right? But not to say that it's still not very enriching and at the same time very fun. Some of these workshops that some of the pictures, as you can see in your screen, highlight some of our different workshops that we had. I think you see Vanessa, they're doing some casting, and you see some of our scholars presenting on their scholarly activity or practicing before they actually present their scholarly activity at the symposium that Vanessa just described as well. And we have over here suturing with a banana. So just it gives you a better idea of things that that we would be doing in the summer program this upcoming summer. And then this is just more additional pictures. Obviously this past year was all virtual. On the very top corner over here, you can see a screenshot of our scholars with Dr. Anthony Ayen, who is he's a leader over at the California Endowment. He's also a physician and also an attorney, I believe. And he was one of the first few researchers to start looking at how your zip code affects your overall well-being, and how that affects your lifespan and how long you live. So it's definitely interesting, and that's just another example of speakers that we'll have during the summer to provide you additional knowledge on health equity. And Rosa will be able to share a little bit more about her experience in the summer.
So this is a close-up of the banana. Sorry, let me mute my. Of the banana that Eric was showing earlier. So I stitched this. I'm very proud of it. So I don't think I mentioned that I did the program 2 years ago. So like Eric said, in person. And I really do hope you get to do the clinical skills portion, at least in person. We got to, in the middle, we got to learn how to start like an IV, things like that. On the left, you can see refining veins, giving injections, and, you know, starting IVs and things like that. It's just so much fun. The workshops that Eric mentioned, I remember I also had the pleasure of hearing Dr. Anthony Eaton speak, and he was so empowering. Being able to kind of put into words the things that we experience, like I'm very passionate about like my community and why are things the way they are? Why don't we have equal access to healthcare? Why, you know, all these things that we see, all these injustices and inequities, and really thinking about why. And so we have like experts in the field that came to talk to us, that I carry their words with me, you know, to this day. And actually, while I was interviewing it for medical school, it actually helped me out too, because to be able to put into words ideas and emotions that I had about my community into like academic language, so to speak, right? So I think that really helped me out. Another workshop that comes to mind is how Dr. Angulo mentioned earlier, like SOAP notes, so like taking patient histories, practicing with patients. And there was a workshop on called Motivational Interviewing with Dr. Kilgore. And I learned so much in that workshop about how to create a plan with a patient for, you know, that they wanted, a plan that they wanted, not that I forced onto them, right? So at UC Davis, during my last semester, I was like, okay, I'll sign up first. They asked like who wants to go first in terms of patient interviewing, and we're all virtual, so it's cool that you all get to practice that. And so after I finished my patient interview with a standardized patient, the facilitator really is like, wow, like that is that real good motivational interviewing. And I was like, thanks. And I told them about the workshop and all this stuff. So these are like skills that that really helped me, that we still haven't learned in med school yet. So I'm really excited for you all to experience that. It really has given me more confidence in medical school. It's helped make things easier as well. And another thing I wanted to share is like the one-on-one support that Annabelle is talking about. Like, she really sat down with me and helped me go through my application in terms of applying, how to apply to school strategically, helping me with my secondaries, which it's gonna, once y'all get there, you'll see it's gonna be essay after essay after essay. And she really helped me, you know, sit down and really think about how to tackle the application. You know, it can be overwhelming, but Annabelle really does care. She really will help you. And the other thing is, in the picture on the left, you see that there are some students who are pre-meds or pre-PA or pre-nurse practitioners. There's also med students in the picture, nurse practitioners and physician assistant students. So it's like we got to mingle and do workshops together. I got to talk to a lot of them about their experience in medical school, or, you know, if people were interested in PA school, they got to talk to PA students about that. Same with nurse practitioners. So it was amazing to get that firsthand experience, you know. And because of this summer program, I just fell in love with the mission of AltaMed because I felt like I aligned so well with it that I wanted to keep going. You know, I wanted to, like, what else can I do at AltaMed, you know, before I go off to medical school? So I applied to be a community health fellow. And, you know, you can always ask me more about that later, but being an HCOP can help you form those connections and those relationships to help you kind of, if you're looking for a position in AltaMed in the future, in like an internship or something like that, which I thoroughly enjoyed. And I had I worked with a great supervisor and a great team there as well. And that brings me to the next slide, which is what I feel the most important part of AltaMed was, like the HCOP program and AltaMed overall, is the sense of community. I think it's more so about the community that we built together. Like each and every person that you see in this picture, they're incredible, they're unique. And I've never been surrounded by so many people who, like, yes, we're all unique and different, but that had the same kind of story, you know. Most of us, we came from first generation, we were first generation college students. We didn't have the guidance or the mentorship or anything growing up. So we related to that. Like we grew up in underserved communities, and just all of this, like each of them has their own story, and they really inspired me and still do. And I'm excited for you all to join the program, and then you kind of start seeing each other at conferences afterwards, and during your med school interviews, things like that. And anytime I see somebody from the HCOP program and like webinar conference, and I just get so happy just because of the connections that you form. You know, they're lifelong friendships. And there's also people who are applying right now who will ask me questions like, can you help me out with this? Like for med school and things like that. So definitely, and not only the students, but the mentors, like Dr. Angulo, like every single speaker who comes, Annabelle, like all of them, they are also just like us. So they know they struggled, they didn't have guidance, and they just want to give back, you know, so that we don't have to struggle so much like they did. And they really advocated for me, not only like in the program, but afterward too. Like even after the program ended, they were still, you know, if they had connections with people in admissions, they would try to help me out, things like that. So, and I can call, email, text any of them, and they're there for me. And that's huge. And I think what it all comes down to is like the greater mission of us working together to kind of uplift the community as a whole, right? Of where we come from. Because all of us were very passionate about that, right? It's like the ultimate end goal of hopefully, like Dr. Angulo or Annabelle said earlier, is to come back and serve the community, right? So that's definitely my goal, and I'm excited to be able to do it with, I know a lot of people in this picture, we're going to be working together, right? I know that Eric and Vanessa, I'm going to be working with them too. And Eric and Vanessa worked so tirelessly during the summer to make the experience incredible, that, you know, the connections that I form with them too are also going to be lifelong. So please, if you have any questions, feel free to ask me anything. I'll be happy to share.
Thank you so much, Rosa. Thank you for sharing all those words, by the way. It's very kind of you. I do also want to make sure that we have some time to for Priscilla, if it's okay with you. Do you mind sharing a few words about you know, your experience in the program? And then for our audience, if you have any questions for Rosa or Priscilla, we'll also have a Q&A at the end of today's presentation for that as well.
Yeah, so like I mentioned, I've participated in this past summer's program. So for us, it was fully online. It was really amazing, really great experience. I actually like pulled out my notebooks. I like used one notebook for the whole program, And like, I just looked through it and I'm just smiling because there's so many like quotes or things I wrote down that were really inspiring and really, every person you meet, every speaker that we got, we had really like powerful, like people of color who like just, who look like you, like who were great leaders within healthcare. So you just were like, you just felt more motivated that, you know, I could get there. Like I'll be there soon, you know, I'll also be doing those things. So I think that was like one of the biggest takeaways that I got. And I had never learned about like the specifics about like SOAP notes and like being able to go through that with med students. So like, and the iHuman, what a few people had mentioned already, like it's pretty cool. It's kind of funny because like the patients are like created to be like real patients, and it's kind of funny because you're like talking to them, but they're just like virtual. But they have like really like real life responses, and you get to go through everything. And it was pretty cool because it was split up where like we did like part of the procedure, part of the visit with them, and then like we would like do research on your own if you wanted to see like what diagnosis based off like what we, and I really felt like, oh, like I'm kind of like a doctor right now, you know? So having that experience was also really cool. I had never had it. I try to plug myself into a lot of like pre-health, pre-med programs, but I never had that exact, like just such a specific mentorship that gave me an idea of what my future would look like. So I think that was really, really awesome too. I think the last thing I'll share too, I was really interested in research throughout like undergrad, and I was able to participate in some things, but I really like that this program made it really open to like a lot of topics. And the topic that I thought was pretty applicable to the times we're living in was like telehealth, and how telehealth translates into like specifically within AltaMed, and how patients are reacting to that and stuff like that. So I thought that was really amazing too, that I got to meet the SMEs, which is the subject matter expert, yes. Which mine was like Dr. Lamelli, which was a really great doctor as well, that was really invested in like building our research skills and all these things. And I think overall, like I think, I don't know if y'all can relate, if y'all are still in school, or like, I think it's hard to sit down in front of like a Zoom, like for so many hours. I took a semester or a quarter online, and I could not like sit down for my lectures, but like I looked forward to like these Zooms. Like that's how like good this program was. But like I looked forward to like sitting down for hours and like being in front of a screen, because all the people are like, again, like everyone really wants to serve the community. We're not there to talk about like how do we like become great money makers, but it was more about like how do we serve our communities, what's the best care that we can have. And if you want that environment, I think this program is all about that. So so I'm excited to see if y'all get a hybrid component, that'll be really fortunate, you know, following all measures, of course. But I think that it was still a really great experience online. And yeah, and any questions as well, I'll be here too.
Thank you so much, Priscilla.
Eric, if I could add something, you know, for the two, it's really nice to have both versions, right, of Priscilla's experience and Rosa's experience. And the funny thing about it is that Rosa did not get that clinical component that Priscilla got. And the reason for that is they got the more suturing, those workshops, right, the suturing workshop, the how to put in an IV, but they didn't actually get in to go to clinics because we weren't, you know, we didn't have that capacity to do that, right? To put them in clinics and see patients and learn the SOAP note. And then this year's cohort, well, the 2020's year cohort, got to have more experience in the clinical setting. So it's really interesting to see both of your experiences because a lot of this year's, you know, 2020's cohort got to have a lot more clinical experience because it was in a virtual setting. Because we could Zoom in any type of provider and give you that perspective, right? From a provider's perspective, because it was easy to just bring them in on Zoom, right? Or it was easy to disseminate a platform, a patient platform, and not have to deal with HIPAA and violations and stuff like that, or expose you to COVID, right? Even the medical students were only virtual as well. So I love that you guys get to hear both versions of the program, and we don't know what it will look like, but we will be sharing as soon as we get information from the, you know, because this is a federally funded program. So they are the ones that make the guidelines on what we do. But we definitely want to do something hybrid if possible, right?
Thank you so much, Annabelle. And now that we provided some context about the summer program and the different components, we will jump into program criteria for the summer program, if that's okay with you all. And then we'll have time for a Q&A afterwards, of course. For the general eligibility criteria, and this was established by HRSA, which is the federal agency that funds our program. I can't remember off the top of my head what the HRSA stands for, sorry about that. But to be part of the program, you need to either be a student in community college, be an undergrad, or be a recent college graduate. So as long as you're not in a health professional graduate program already, you're eligible to apply. Well, the only exception, and you have to, and you can be pursuing any health profession, with the only exception being any nursing degree. And the reason for that is because the federal government, HRSA, already provides funding for another program that it's for folks that are pursuing nursing programs such as LVN, RN, MSN, and NP programs. And we can share more information offline if you are interested in those as well. And the other requirements set by HRSA, again, is that you need to come from either an economically and or educationally disadvantaged background. And the next slide will provide definitions on what that means. But you have to be either, you don't have to be both, you can be or, right? So educationally or economically disadvantaged and come from a disadvantaged background, sorry. And be a US citizen or resident to be eligible to receive grant funding. But AltaMed does also accept DACA recipients or anybody who does not fit the criteria, such as being a US citizen or resident. And AltaMed funds those folks completely, from our own funding, not from federal funding. And I know some folks had sent me questions about that, and we'll make sure to address those as well. During our Q&A, but AltaMed, and that'll be on a case-by-case basis, but AltaMed does have funding set apart to be able to support folks that would otherwise not be eligible to apply for the federal program. And then just desired criteria, it's pretty much everything we've been talking about, during today's presentation, and there's some type of tie to LA County or Orange County, because that's where our communities live for AltaMed and our patient community, and most importantly, be mission aligned with AltaMed Health Services. Well, what we mean by that is that you are interested in serving medically underserved communities, and that you are interested in eliminating health disparities among communities of color and communities that otherwise would not have access to healthcare. Sorry, that was about it. Team, anything else I might have missed during this slide that you would like to add?
No, this is good. Mm-hmm.
Perfect. Thank you. And then I know this is a lot of text, but I just wanted to make sure that we had a slide with what the definitions mean to, as far as being educationally and economically disadvantaged. This information is also available on our application. Once we'll provide you with a link, but I just wanted to make sure that we had a space for it during our presentation. So for example, to be educationally disadvantaged means that you are a first generation student, which means that you are the first in your family to graduate from college. With your siblings can be in college as well, as long as your parents don't graduate from an institution that grants any type of degree. So as long as they don't have an AA degree or beyond, that would make you educationally disadvantaged, or that you graduated from a high school with a low percentage of graduating seniors, and so on, right? So we'll make sure to have all these definitions available for you afterwards, and as you're completing the application. But again, I just wanted to make sure that you were all able to visibly see them, and then we can answer questions as well during our Q&A. And then to be economically disadvantaged just means that you either received, and team, feel free to correct me if I'm wrong, but it means that you received free or reduced lunch during your, through K through 12, and that you meet the eligibility to be considered low income based on the definition set by the US Census, which changes every year. And we'll have the links for that as well to provide you, to make sure that if you have any questions regarding eligibility, or if am I eligible or not, you'll be able to double check that before completing the application as well. And team, anything you would like to add for that one, or are we okay to continue? Perfect. And then program timeline, which is the most important part right now that we've shared information about the summer program and everything we would be doing during the summer program. We do want to provide you with a few dates to keep in mind. Our application did go live 2 weeks ago on the 11th, and it will stay open for about 2 more weeks until February 14th, which I believe is a Sunday. So as long as you submit your application before Sunday at 11:59 p.m. On February 14th, we'll be able to review your applications, because we will only be reviewing applications that are fully completed up to that date. And we'll notify our applicants about their application in April of 2021. So in a few months, just to make sure that you have enough time to plan your summer with enough time. And our summer program will be from June 21st through July 30th to make sure that, and we want to provide you with these dates, sorry, to make sure that you know how to best plan your summer out for, summer's really around the corner, right? It kind of creeps up on us really fast. So we want to make sure that you at least have the dates. And the program, again, will be Monday through Friday for approximately 6 hours each day. And on this slide, we wanted to provide you with some of the essay questions that will be on the application itself. And the reason that we're doing this is because, one, we want to make sure that we're able to provide you with additional information on what we're asking on the application. These essay questions are also on the application, of course. But I wanted to address this because our application does not require you to submit any types of letters of recommendation, or it doesn't ask for any reference of that sort. We just want to make sure that we're not creating additional barriers for you to not complete the application. We don't ask for a GPA. So because of that, we want to make sure that when we're deciding on who to admit into the program, a lot of our rubric is based on the essay questions and how you answer these questions. So if, feel free to ask any questions about these different short essay questions that are on the application. Each one is for about 250 words, so about a paragraph for each one. Yeah, I just wanted to make sure that you had, you were able to see these questions beforehand, right, before actually going through the application itself. All we ask about is for your background and some of your experiences growing up, and then any relevant experience that you have as well. And then what you hope to gain and contribute to the program, and if you faced any educational or economic obstacles throughout, your life. And now I'll provide you with a quick FAQ, and then we'll jump into the Q&A with everybody, if that's okay with you all. So as I mentioned earlier, there is no GPA requirement for our summer program. As far as admissions go, right? So we don't have a GPA cutoff or anything of that sort. The program will take place, at the moment we're planning for a hybrid program, but we're waiting for final word from the funding agencies, which is the federal government, to give us additional information on how the program will be structured for this year. And then another question that comes up a lot sometimes is, can I work during the program? And of course, we understand that, sometimes you have to work because it's you need it for your own livelihood. But what we share with folks that are interested in applying is that the program is very time intensive. So because of that, we want to make sure that you're not stretching yourself too thin, and you're still meeting the time commitment needed for the summer program. This summer program will go on for a couple more years and in the foreseeable future. So if this is not the ideal year, please keep us in mind for another year as well. But we want to make sure that you're not doing yourself a disservice, right, by being super thin, or that you're studying for the MCAT. That question also comes up a lot. Or can I study for the MCAT, or can I be taking courses at the same time as I'm participating in the summer program? And because of how time intensive the summer program can be, we want to make sure that you're successful in the program. So we do not advise for you to be studying for the MCAT or the GRE or any other exam, or taking courses that otherwise might require some time, right, as well, aside from the summer program. And then you do not need to be pre-med to participate in the summer program, as long as you are pre-health and you're interested in serving medically underserved communities, we welcome your application. Of course, with the only exception being any nursing degree due to funding restrictions. And I just want to leave you all with a quote from Dr. Angulo that he's always sharing with our team, right? Which is born to serve, trained to lead. And what I take from this is that that desire to want to work with our communities and want to serve those that are otherwise don't have access to healthcare. It's kind of in you, right? You growing up, when you decided you were going to be pre-med or when you wanted to be a health professional, that's always been inside of you. But you're not always trained to lead or lead some of this work, or and you know, I think AltaMed, along with our team, can support you with that training, right, on how to make sure that once you're that great health professional, you're still able to take on those leadership roles within our community as well. So thank you all. We want to make sure that we have some time for a Q&A. So please feel free to either put your questions in the chat box or unmute yourself and ask your question as well. I do have the application to, I know some folks are talking on the chat box. Thank you, Rosa, for posting the link to the application. We also have this QR code. So if you grab your phone, you can also scan with your camera, scan the code, and it'll take you to the link as well. But please feel free to ask any questions.
Eric, I got some questions from the chat. So do they need to provide any documents to prove their income status?
Thank you. Great question. Is that you, Taylor?
Yes.
Thank you. For that question, during our application, we collect information regarding eligibility. And then if we work with Charles R. Drew University, which is our funding partner, we make sure that if there's any requirements, any additional documentation that needs to be collected, we'll collect it at that point, but not for the admissions purpose of the application.
And the other question, really quickly before you get to everybody else, there was a question about if they're not eligible to apply for this because they're working or have summer courses, are there other ways that they can get involved with AltaMed?
Yes, of course. We have a couple other opportunities as well, such as I know a few folks mentioned it here. We have a community health fellowship, and then we also have project internships or internships available. With those, it's a little bit different because as long, if you don't mind actually, so I don't misquote, send me an email and then I can follow up with additional information on that, if it's okay with you all. But there is other opportunities at AltaMed, in short.
And then Vanessa just posted the Community Health Fellowship website, the link on where to apply on the chat box as well. So that's the same opportunity that Priscilla is currently participating in and the one that Rosa participated. So you could actually stay on the AltaMed pipeline, right?
Yes, thank you, Annabelle. And with that link, if you complete the application for additional information, we'll make sure to follow up with you as soon as those applications go live. And any upcoming opportunity, we'll make sure to share it with you as well.
Hi, Eric. I also have some questions on my end that came through. When does the program end?
The program ends July 30th.
Okay, July 30th. I have another question around interviews. So do you interview applicants or is our acceptance only based on the questions on the application?
In general, yes, we do not do interviews. We do our admissions based on how you answer the essay questions.
And I think one of the things that we want to include is that we also have an admissions committee that reviews the application. So you don't have one person, because we know that admissions is very subjective, right? That so we have two people that read the application and then don't give feedback to each other until it's time to fully review the application. And if there's like something that's still like the two people that review your application are still kind of going back and forth, that's when we contact you personally to get a little bit more details about what we have questions about. And most of the time, to be honest, it's on the financial questions, right? So submitting your parents' financial records or anything like that, because this is a federal program. So we have to, very similar to what you have to submit to when you apply to financial aid, right? We follow the same guidelines.
Thank you, Annabelle, for that. Yes, for the additional context on our admissions, we make sure that each application at least gets read twice, and we make it as fair as possible for everybody.
And another question is, do you recommend to apply to this program the same year you apply to med school, a year before you apply, or maybe as a re-applicant to med school?
Annabelle, can you share a little bit of insight on that question?
Yeah, honestly, there's no sweet time to apply. We love to have students in all stages of the process. This year was one of the first years that we had a student who had just finished their first year in undergrad, and then students who had been out of college for a long time, very similar to Rosa, like were career changers. So they had their own professions, were teachers in another life, right? And now they're coming back to kind of get back into the pre-med world. And we love that diversity in age and experiences, because that kind of just enriches the program more, right? And I think it also goes to show our scholars that like, these are all the different paths that you could take and still get to that next level. And our medical students represented very similar. It was really interesting that the medical students also represented the group the same way. We had medical students who had been like out and done other things, and now we're actually in medical school, right? And then medical students who had just came out of undergrad and went right into medical school. So we think that any time is a good time. I think as long as, like Eric mentioned, as long as you have the time to put into it, because it's 6 weeks and we expect you to be here for 6 weeks, right? And we shortened it for Priscilla's group because we knew it was going to be virtual. But if we do go live, or if it is a hybrid, we'll make sure to tailor it to depending on the need, right?
Thank you, Annabelle. Any other questions that you received?
Yes, one more before you ask the two that have their hands raised. Sorry, you guys, for waiting. I see you're waiting. One of the questions is, how many people do you usually get applying, and how many are you accepting?
Of course, yeah. Annabelle, I see you unmuted yourself.
Sure. So we accept, because the guideline is 25 students, and then we've set up a budget within 25 students with HCOP, direct HCOP funding. And then AltaMed has committed to DACA students and other students, right, to take on those students as well, since DACA students don't directly qualify under the HCOP guidelines. AltaMed has committed to also invest in DACA students because we see the importance, right?
Thank you.
So we're between 25 to 30.
I have one question on my end. Does the application have a save button, or do we need to complete the whole application in one setting?
It saves automatically. So if you start your application, Google, for Chrome, it'll save it automatically. If you go to a different web browser, though, you'll have to restart it over. So my best advice to applicants is to everything else can be done in one sitting, but those essay questions that I had up earlier, I would work on those beforehand. So then by the time you're ready to submit, you just copy and paste your responses onto the application. And we have those instructions also on the application itself.
You have 3 people with their hands raised over there.
Let's see. I don't see them, but can you? Janelli, go for it. Yeah, thank you.
Hello. I was just wondering if the application is on a rolling basis. Yeah.
Thank you, Yaneli. Great question. It is not. It is not. So as long as we start our review process after February 14th to make sure that everybody has enough time to submit their application.
Thank you.
Stephanie?
Stephanie Lara?
Hi, sorry. I had a question. So I'm going to be reapplying, and I noticed that the questions are the same. So what advice would you give me in order to kind of alter my answers?
Yeah, I honestly, Eric and I reviewed a good chunk and re-reviewed a lot of the committee, those that had kind of tug of war, right? Our admissions committee had a tug of war, like, I don't know. So Eric and I took the time to re-review them. So if you are reapplying to the program, I suggest that you change or modify or even update your answers, just like how it is for grad school, right? I always tell students who are reapplicants to medical school, don't update your statement. Things have changed in the year that since you applied, right? So the same approach that you would take to that, I would update, you know, unless like your story stayed the same, right? But the questions are the same, but maybe there's something different that you learned this year, especially with that. Think about how many changes you guys have all made in your life with pandemic, right? Rosa starting her first year med school online, white coat ceremony, something that you've been waiting for so long and had to be online, right? But then what did you take from that, right? What kind of growth did you have from that, right? So the same, I would approach my statements the same way. Does that answer your question? No?
I think one thing too that I would add is, you know, something as simple as like reading the question. I think there's one question that asks you to talk about how you've demonstrated your interest in serving the medically underserved. And so oftentimes we've seen applications where it's kind of like a laundry list, you know, and so maybe just explaining a little bit more exactly how you went about demonstrating and kind of not just talk the talk, but how'd you walk the walk type thing. So that's one thing that I recommend.
Yeah,
And I know we're saying like essay. Yeah, of course. No, I know we say essay questions, but it's really just short answer. We've done that purposely because we know how hard it is, you know, and for those of you still in school, we just want to make the application as accessible as possible to everyone. And so it's really just short answer. Another thing too that I would recommend is we can really tell when you've put effort and you've kind of laid your heart in the application. So I think we really appreciate applicants that do that.
And I think the other thing I would add for the underserved, that could look so different for everybody, right? So it doesn't have to be like, I fed the homeless for 3 years or the houseless population for 3 years. See, one of the HCOPers taught me that word. So from Priscilla's group. So I have to be careful how I houseless individuals, right? But it could look so different, you know, and maybe it looks completely different. Like maybe it's been your own family or loved ones or friends that have been underserved and you supported that, right? So it could look very different, but I think as long as you answer the question, right?
Okay, I think Jessica was next.
Hi everyone. So my question is regarding location. If we're not from the LA County, personally, I'm from North California, but we do have ties like family over there in LA. How does that, like, do you see that differently? Do I have like a disadvantage to applying?
I would say no disadvantage when applying. But since some of our program requirements might be in person, obviously pending, you know, updates, you will be required to be for those in-person components of the program in person. So, and you know, you would have to also, if you do have family in Southern California, maybe staying with them, right? But yeah, if hopefully that answers your question. It does not, you know, work against you, but for those in-person events, you will be required to be there.
All right, I think next was Bo.
Hey y'all, thank you so much for that amazing presentation. I learned a lot. My question is, how can students make the best out of their experience once they are interning at AltaMed? Notice like Rosa and like the other interns like took notes. What are other ways that students can make the best out of their experience? Thank you.
That's a great question. That's a really good question. I'm actually going to defer back to Priscilla because she just had the experience, and then Rosa, if you guys feel comfortable answering.
Yeah, that's a really great question, Bo. I think what helped me a lot too is just like really, so you're getting some really great contacts with really amazing people. And I think sometimes it's scary to like reach out to them, or like, I think to get the most out of the program is definitely like the people who like you really see like align with your passions is like emailing them or setting up a phone call with them. I remember there was a psychiatrist, I'm really interested in psychiatry, and someone, we had a speaker, a female doctor who came in, who was interested in psychiatry. I reached out to her. I was like, let's set up a time to call. And I feel like that really helped me, or even with the med students. When I was applying to the community health fellows program, I reached out to the med students to help me, like, can you review like my application, or just like, I think that you get more out of it the more contact you make. And whether this next year will be virtual or in person, I think like making the most of that virtual component is just like emailing, texting, or whatever way that you can. I think that's one thing I would add in on top of like the notes. Like, yeah, my notebook was like my best friend. It was like just like getting all of that, like reflecting, journaling afterwards. Because I think Rosa, actually, I remember Rosa spoke at our HCOP, and she told us that some of the things that she wrote down during the program, like she used during her med school, like application, like interviews and stuff like that. So I was like, I need to write some notes like Rosa did. So that's another recommendation. Yeah.
Thanks, Priscilla. Yeah, I second everything Priscilla said. I did write a lot of notes just because they're, I mean, we're learning, like, you're going to be learning from experts in the field. So it's like, of course, they have a wealth of knowledge. You want to, make sure that you hold on to that. Also, like Priscilla said, the connection. So I'm just listing a few examples, like you make a connection, like someone was interested in research in like genetics, something like that. So then they connected with the speaker who spoke about that, and then got connected with like a research project, things like that, right? Or med students, you have a med school interview and you made some connections and you have somewhere to stay, right? For free when you're interviewing, and you have the inside scoop, things like that. So I definitely second everything that Priscilla said about forming connections.
And then Priscilla, this is just to add, like if it were to be virtual again, right? Because we don't know where this pandemic is. Did you feel like it still felt like intimate? I don't know if you could speak a little bit about that, or did it still feel personal? Like, because, we missed that component, right? Of course, who doesn't want to be in person and getting those vibes and hearing the group and seeing how everybody's feeling? But did you feel like you got that experience as well?
I think that I definitely had to put more effort than I imagined, like in person, of like being intentional. So like I remember throughout the weeks there was like office hours, or like you can come early before we get started to like chat with people. So I definitely think that like that would have come naturally in person, like kind of just waiting and talking to the person next to you. So you kind of do have to put in more of that like intentionality if you do want that more intimate perspective. So I tried to go to the office hours, or like stick by and talk to the med students who weren't in my cohort, and even that aspect, we had like you were paired with a med student, and then like a few other HCOP scholars. So then that felt a lot more intimate because you're spending so much time with them, like on the research and stuff like that. So I was able to connect with them a little bit more. But I think that's my perspective on that. Yeah.
Thank you. Any other questions?
I think Amber, sorry. Oh, go ahead, sorry. And then we'll go.
Hi, thank you so much for this presentation. It was great. I am really looking forward to applying to the program. I just have one quick question on the application itself. So the very question says, has your family ever received one or more federal or state assistance programs? Personally, my family has not, but I am a first generation college student. If I know to answer the question, it takes me immediately to the end of the application itself, and it doesn't allow me to apply. So does that mean that I'm not eligible to apply to the program? Should I answer yes? How should I go about that?
Who was that again? Sorry, that was
Amber.
Oh, Amber. That's a good question, Amber. That should not be the case. You should still be able to continue with submitting additional information for eligibility. I'll look into that right now after our presentation, and then I'll follow up with everybody who's here today if that's okay, because you should be able to continue the application.
Yeah, so it's an and or an or, right? So you could be first generation in college and or low income. So if you have both, then it doesn't give you an advantage. But those are the requirements that the federal government has given us, right? So then you could be first generation and you qualify, or you could be low income and you qualify, but you're not first generation. So
thank you. And I know Joanna shared everybody's email who registered for today with me earlier today, so I'll make sure to follow up with you all.
Thank you.
Of course. Other questions? Nadia?
Yeah, hi. Thank you for putting this presentation together, by the way. It was really informative. I was just wondering from like the administrative and like mentorship perspective, what are the biggest indicators of growth you've seen between students entering the program and coming out of it?
oh my gosh, that's a loaded
That's a that's
wow.
a really thought out question.
Honestly, I've been working with undergrads, similar to yourselves, undergrads and college students who are pre-health for the last 15 years. And it enhances, but I think you're already bringing in all those skills with you, right? I don't think we did anything additional for Rosa or anything additional for Priscilla because they were already carrying those things with them. Like they were already leaders in their own entity, right? They were already like really seasoned. So I think the program just kind of gives you maybe those talking points that are missing in your application, right? Or those connections to individuals who are doing the work. Now, if you're first year, it could be like if ending your first year and applying to the program, it could be really overwhelming because you're like, oh my gosh, this is so much. I'm hearing from a psychiatrist one day, I'm hearing from social determinants another day, I'm hearing from a culture of medicine another day. So it could seem like a lot too, right? But at the same time, we're at least implementing that seed that hasn't been there, right? So honestly, I think like you'll get and you'll see what you put into it. Honestly, that's the only way to see it. Because I don't think we changed Priscilla at all. I think she was already who she was. And then we noticed her skill set. So we tapped into that potential when we were looking for additional interns, right? We're like, oh, she's gonna be great because she wants to be a psychiatrist. She's already doing that type of work. So I would love for her to be part of this, right? Mm-hmm. So I think it could just add to your value, but you should never forget your worth. You already have so much, Yeah. And people always think like, oh, once I get into graduate school, specifically medical school, I'm going to be this amazing doctor. You guys are already amazing. Like, think about your like growth experiences, all the things that you carry with you, So I think it's just going to add value to who you are already as an individual.
If Annabelle, if I can add to your answer, something that always sticks with me is more than anything is the community building, right, from the summer program. And maybe that's something that changes as far as like knowing that you have a cohort of folks that you can call upon, right? Because, and Dr. Angulo always mentions this too, that a lot of people want to serve the medically underserved, right? But then a lot of times some folks don't always stay committed to that statement, right? So knowing that there's people who you've spent a whole summer with and you're able to build community with afterwards, like I know that I'm gonna be like, I think Rosa said this earlier, that I know I'm gonna be seeing Rosa, Priscilla, Vanessa for like the next 20, 30 years of my life, and that's pretty special, I think, as well. So I think that's, that's something that folks walk away with, I guess, not having before, if to answer your question.
Yeah, absolutely. And I think the community is so tight, even in the virtual world, you guys, that when I saw Priscilla in real life for the first time, when she was interviewing or got into the program that she's in now, it didn't even cross my mind that I had never actually met her in person. So I was like, Priscilla, come on in. This is where we're going to be meeting. And she was like, wow, it's nice to meet you in person. I'm like, that's right. We've never met in person. Like what kind of weird world are we living in? But that's how I think intimate we made it this summer, right? Even though it wasn't that, human interaction. I honestly, I didn't even cross my mind to like introduce myself and be formal about it because we spent 6 weeks together or 5 weeks together, right?
Thank you. Great question. Oh, go ahead. Sorry, Rosa.
I just wanted to add really quick from the perspective of like someone being in the program. I feel the change that I saw was can be summarized by empowerment. Like I feel we felt empowered because we had people who really believed in us. And I feel like Annabelle doesn't realize how much that meant to me and all of us, but like our mentors, they really believe in us. They see these amazing things that sometimes like we don't know that, you know, that we don't see, right? So that's amazing.
And real quick, I agree with everything. And then also I wanted to add, like, which is not maybe like just like a side thing too, is like terminology and language. I think I came out of like that program, like just like so many words or so many like ways that things that I felt about like the frustration I felt towards like a lot of inequities and like society and the communities I wanted to work with, like hearing so many perspectives and like people who are so invested, so they have so much language, like specific terminology, like just what Annabelle was mentioning with like homelessness versus like houselessness, or like food deserts versus like food swamps, or like just like I really liked one of the researchers who came in like spoke about like how a lot of times we focus on like underserved communities, but we could also say like historically disinvested communities to focus on like the fact that like it's not like that these people are like naturally underserved. It's like there's people who have historically like on purpose like created these barriers, like just all these things that I was like putting language to like all these feelings and like knowledge, like and being able to now like apply that into like my future as well, I think was another like small component also like of what everyone else was mentioning.
Absolutely. Absolutely. I love that, Priscilla. You're right. You know, we've learned so much, and it was really neat because, you know, some of you guys are very versed too, right? And I don't know if you remember, Priscilla, but like when one of the presenters, and his thing was cultural structure, and basically like the modified cultural competence, and one of our learners, or who we're still working with, was like, you know, we shouldn't be using the term homelessness because that's tied to someone's, like, home is very personal, right? You could carry home wherever you are. And he was like so shocked by it. That presenter was like, what? Oh my gosh, no one's ever put it that way. The same thing with like food deserts, and being very conscious, because we have a lot of native folks who live in deserts and have been able to live, right, and sustain families. So what does that say about that too, right, when we use words like that? So you're totally right. Completely right. I also want to be conscious of your time, so we're a little bit over. Any last questions, like burning questions I can't take it, I have to ask? If not, you have our information as well.
Jessica, I see you've had your hand up for a while. Do you have another question?
Oh yeah, I have another question, but if not, I can just email you guys. It's fine.
I mean, you sure?
You could ask if it's not too personal.
Okay, yeah. So it's just regarding the application with the economically disadvantaged. I remember you were saying in the PowerPoint that if you received like through K through 12, if you received a reduced lunch or free lunch, that qualifies you. But if that happened, but then now you're not like at the like present right now, that's not your, like you're not under the poverty level. How does that, do you say yes or no to the answer?
I would say go ahead and answer it based on how you grew up, right? Because we ask various questions to make sure that, you know, there's multiple ways to assess how, if, you know, your eligibility for the program. So if it was for the majority of, you know, of K through 12, then I would answer that as yes, right? But if it was like 1 year out of your whole 12 years of, you know, like K through 12, then it might not be, you know, so. Yes.
Or 0 to 18, right? Because that's
0 to
how,
18.
so the AAMC, if you're applying to medical school focuses on between 0 to 18, what was your status? How was your status like? And what neighborhoods did you live in? Like what zip codes did you live in? Because those are your formative years, right? And those are the ones that have the most impacting our social determinants of health, right? So as long as you focus between that range, you should be good.
Right. Thank you for that. But if you have more, you know, you want more insight, feel free to email us as well. Right. Otherwise, thank you all for your time today. And
thank you, Rosa. Thank you, Priscilla.
Thank you to our team who supported with today's presentation. The Mi Mentor team will be able to follow up with you regarding the recording, you know, for today's presentation, if you want to just revisit it. But if you have any questions regarding the program, the application process, Feel free to follow up with Annabelle, myself, Vanessa, Priscilla, or Rosa as well. And then I'll look into the application for you, Amber, and the rest of the folks to make sure that you're able to continue with that. And I'll be in communication with you all. Thank you so much for today.
Thanks, everyone.
Eric, do you mind staying?
Thank you.
Not at all. Not at all.
Vanessa, just for a little bit.
Of course.
Thank you guys. Have a good night.
Thank you. Thank you for
Good luck. Thank you, everybody. Rosa. Let me start recording this.